Hey everyone, welcome back to my channel. If you're new here, my name is Sandra. I'm a family and pediatric nurse practitioner, and I've worked in the emergency room the past 4 years as a nurse practitioner. This is my little dog Reese. She's an Imperial Shih Tzu and she just turned 10 years old. So she's gonna hang out with us for this video. If you're new here, please subscribe to my channel and hit the notification bell so you get all my new videos. I talk about anything related to nursing, being a nurse practitioner, and anything regarding health and wellness. So if you'd like to be a part of this, please hit the subscribe button. I would love to have you here as part of my channel. All right, so in this video, I want to talk about the pros and cons of being a nurse practitioner. I've been a nurse practitioner for the past 4 years. I have dual certification in family and pediatrics, and all of my nurse practitioner experience so far is in the emergency room. So a lot of these pros and cons are based on my opinion and my experience, but if you're thinking about becoming a nurse practitioner, I think this video will be helpful to you. All right, so we're gonna start with the pros of being a nurse practitioner. So my number one pro of being a nurse practitioner is the job satisfaction. It is just such a fulfilling job to be the person to make that difference for patients. Anytime someone leaves feeling better or with a smile on their face, it's just so rewarding. And it always reminds me of why I love what I do and how rewarding this profession is. Especially those cases where patients come in feeling so awful and so terrible, and they leave feeling so much better and they're just so grateful. It's so rewarding to be the person who made that difference for people. So I would say the number one thing about being a nurse practitioner has been the job satisfaction and the fulfillment of making that difference for people. So another pro of being a nurse practitioner has been the amount of learning and critical thinking and always using your brain. Every single day I work, I learn something new. Medicine is always changing and new research is always coming out, and we need to stay up to date on that. So being a nurse practitioner has been a never-ending learning experience so far, and I never feel bored in my role or that I know everything. It's a very humbling position to be in, to actually be practicing medicine. It's very nice to be using the brain every day, to be learning new things, to be staying up to date on medicine and the latest research. So if you're someone who loves to learn new things and loves to use your brain, then you're gonna love being a nurse practitioner. All right, so this one might not be a pro for everyone, but it was definitely a pro for me, and that is doing the procedures. I absolutely love doing procedures. I love draining abscesses, I love suturing, I love all those fun little procedures for a number of reasons. This might be a gross story for some, so if you don't like gross, maybe just fast forward this. But when I was a nurse in San Diego, I was helping one of the residents drain a shoulder abscess on a patient, and this abscess was probably this big. And you know those little 4x4 containers of sterile gauze? Well, he opened up that abscess and filled one of those entire containers with pus, and then had me running to get more because it just kept coming. If you're someone who enjoys Dr. Pimple Popper and enjoys draining pus, then you're gonna be like me and just love these kind of procedures. There is something so satisfying about draining pus. So that's one reason. And then I just love having that little bit of extra time with patients where I can talk to them for 10 minutes and not be interrupted, not be pulled out of the room. It's just so nice to be sterile and just have 10 minutes with my patient while I'm suturing their face or draining an abscess. And I get a chance to know patients on a more personal level that way. So I've always really enjoyed having that 10-15 minutes where I can just spend it with that patient while I'm doing the procedure. So another pro of being a nurse practitioner is the autonomy. In some states, you can work completely independent of doctors. In other states, you can prescribe medications on your own, you can discharge patients on your own, and the doctor will just sign off your charts. And then other states have other levels of regulation. But for the most part, in the emergency room, you work pretty independently, especially in the fast track or urgent care areas of the emergency room, you're pretty autonomous. For the most part, in all the emergency rooms I've worked in, the doctors and the nurse practitioners have a pretty good working relationship. And if the nurse practitioner needs to consult about a patient or wants the patient assessed by the doctor as a second opinion, they're always willing to do so. So being autonomous is really nice if you like to keep things moving, because I remember being a nurse and just waiting for some of the doctors to discharge a patient or to order something would get so frustrating. So now I don't have to wait for that. I can put in my own orders, I can discharge patients, and I can keep the flow moving. So another pro of being a nurse practitioner is that you make more money than you do as a registered nurse. Usually it's about 20% more than you would make as a nurse, but this varies from state to state. This varies if you're working in a rural location or in a downtown city hospital, but I think the general average is about 20% more than a nurse makes. And I feel as though the nurse practitioner wage is more negotiable as opposed to a registered nurse. So another perk of being a nurse practitioner is that it is becoming a very respected and trusted profession. With the growing need for more providers, society is starting to understand much better the role of nurse practitioners and what we're able to do. A lot of times patients now prefer to see their nurse practitioner over their doctor because they feel that the nurse practitioner has a better bedside manner or that more personal touch that comes from their nursing background that a lot of the doctors may not have. So as a nurse practitioner, you will definitely feel very respected and very trusted. So another pro is that being a nurse practitioner can be pretty close to what a doctor does without all the extensive years of schooling or the loans. So if you've wanted to be a doctor and you just admire that role, a nurse practitioner has a lot of the responsibilities that a doctor has and gets to practice medicine in a lot of ways that doctors do. All right, so now we're going to talk about some of the cons of being a nurse practitioner. And again, a lot of this is just from my experience and in my opinion. All right, so one of the cons is the amount of responsibility and stress. I think most nurses head into becoming a nurse practitioner knowing that it's going to be a lot more responsibility and a lot more stress. But until you experience it, in my opinion, I don't think you can possibly understand the amount of stress that comes with that role transition from being a nurse to an actual provider. It is such a complete role change from being a nurse where you're the one doing the orders and doing the bedside care of the patient, but the doctor or the provider is making the decisions for your patients. And then as a nurse practitioner, you are now the one making the decisions for your patients. And that responsibility is so huge. And I don't know if you can fully appreciate it until you experience it. In the back of your mind, you're always wondering, did I miss something? A lot of the times the nurse practitioners are seeing the fast track patients and the lesser acuity patients. But I mean, there's always that chance that a sore throat could be something more serious like retropharyngeal abscess or epiglottitis. And those are the things you don't want to miss. So that responsibility and that never-ending diligence has to always be present, and you always have to consider everything so thoroughly so you don't miss anything serious. And that's why it's so important to know all your differentials for every condition. For abdominal pain, what is the worst thing abdominal pain could be caused by? Or leg swelling, what is the worst thing that could cause leg swelling? And maybe most of the time abdominal pain is just caused by constipation or by a virus. But you need to be aware that it could also be an abdominal aortic dissection, and you need to be familiar with what population that might be seen in. So there's a lot more you need to know and understand as a nurse practitioner. And with that comes a lot more responsibility and a lot more stress. And also with that stress and that possibility of missing something comes the legal risks. So if you do miss something, there's a chance that it could go to court and you'll have to defend what you did. If you do miss something or a patient does have a bad outcome, you need to be able to explain why you did what you did. So the legal risk is also another big thing when it comes to being a provider. And this can be more or less based on your specialty. In the emergency room, I would say there is a higher legal risk because we see all patients. You never know what's going to walk in the door. And there is that chance of missing something or misdiagnosing something, as opposed to if you're an aesthetic nurse practitioner where you're just injecting Botox, or if you're a clinic nurse practitioner where you're just educating about diabetes, those kind of things. So the legal risk can definitely change with the specialty. Okay, so another con of being a nurse practitioner is the amount of charting. You are basically creating a complete head-to-toe assessment on a patient, all your decision making. There is just so much information that needs to go into a patient's chart as the provider. You have to tell the story of why the patient is there. You have to give a complete assessment and document your physical assessment. And then you have to put all your decision making and the outcome of the patient while they were under your care. And this takes time. This takes a lot of thinking and a lot of time. And yes, everyone documents a little bit differently. And yes, some people could probably chart more or could chart less. But at the end of the day, you want to have enough information in your chart that should it ever go to court, it's understandable and it defends why you did what you did, and the judge can understand what exactly happened. So it is very important to be thorough in your charting. Especially if you're seeing a lot of patients, it is very important to still be very thorough in your charting and to not take shortcuts, to not leave things out, because should a case ever go to court, you don't want pieces of your charting missing. I always like to think of my charts as a masterpiece at the end. It's telling the complete story of your patient from beginning to end under your care. So another con of being a nurse practitioner is the lack of compensation for the amount of responsibility. Often you are doing the exact same job, seeing the exact same patients that the doctors are seeing for a lot less money. And I know a lot of times we work under them, but it is a lot of responsibility for only making about 20% or so than what a nurse makes. So I know a lot of my friends, once they graduate as a nurse practitioner, they just feel like it's not worth it, the amount of responsibility. A lot of times nurse practitioners, when they graduate and they start working and they see the amount of responsibility for the amount of money they're making, and including myself, I've felt that way at times too, that for that amount of responsibility, you don't get paid that much more than being a nurse. So just something to think about if you really want to take on that much responsibility and stress for making 20 or 25% more than you do as a nurse. So another con of being a nurse practitioner is that you don't usually get the type of training that you do as, let's say, a new grad nurse. You are just pretty much thrown in. And it's not like we went through a residency. We graduate nurse practitioner school and then you start your job without much training at all. For me, I believe I got about 2 weeks of orientation in the ER, and then I was seeing patients on my own. And that is pretty daunting to have patients' lives in your hands like that. And I feel like a lot of nurse practitioners can agree with this, that you just don't get a lot of orientation. You have to hit the ground running as a nurse practitioner. And coming from being a nurse, that's something you're not really used to. So another con of being a nurse practitioner is that if you're used to getting breaks and you're used to getting a lunch as a nurse, you may not get that as a nurse practitioner because there's usually not someone to relieve you. You're working like the doctors, and if it's busy, you're going to be shoving food in between patients or running to the bathroom in between patients. And I know some clinic jobs do close down for a lunch break, but if you're in somewhere like the ICU or surgery or the emergency room or labor and delivery, you may not get your breaks. And if you're used to this as a nurse, you're just not going to be used to that. And it's just something you have to get used to. So also speaking to the lack of orientation, you end up learning a lot on the job. So for me in the emergency room, once I had my first case of appendicitis and I learned what to order and how to call the surgeon, then the subsequent appendicitis got easier. Or if I had a patient with pancreatitis, any patient with pancreatitis after that became easier. But a lot of learning how to handle these cases just comes with learning on the job. And the more patients you see and the more experience you get, the easier it will become. But that just comes with time. That's why the first year of being a nurse practitioner can be so hard and so overwhelming because you're just learning so many new things every day. So another thing that might be a con to being a nurse practitioner is that working under doctors, often they want you to practice as they would practice. So some doctors order a lot of CT tests and some doctors order no CT tests. And when you're looking to consult on a case and you work with 12 different doctors, you have to kind of adapt to the way they practice. And learning each doctor's preferences can be somewhat difficult, especially if you have your own opinion about it, because they could put in, yes, I agree, or I don't agree, those kind of things. But for the most part, they want to be able to sign your chart agreeing with what you did. And that does get better with experience. As the doctors get to know you and trust you, they will allow you to do things more on your own. Or if you feel that the patient doesn't need a test or they do need a test, they'll let you make your own decisions as they get to know you. But just know that if you are in a state where you're working under a doctor, that usually it's advisable to do what the doctors recommend. But like I said, this gets better with time as well. And most doctors are so good with nurse practitioners and so helpful and open to ideas and working with you to come up with a plan for the patients. All right, so I'm sure there's a lot more pros and cons to being a nurse practitioner, but these are the things that stood out in my mind. And I just wanted to pass them on to you if you're thinking about becoming a nurse practitioner or you're just interested in learning more about the role. So I hope this was helpful for you to understand the nurse practitioner role. If you have any questions, please leave them down below in the comments and I will get back to you. Please don't forget to subscribe and hit the notification bell so you get all my new videos. And if you guys have any requests for anything about nursing or nurse practitioner or anything in general, please leave those ideas down below in the comments as well. Please give this a thumbs up if you like this video, and please also share it with someone who you think might benefit from it. All right, you guys, thank you so much for watching, and I will see you in my next video.